Now, a free 24/7 helpline for people who have mental health concerns. The number 1771 will now offer anyone in Singapore a listening ear and guidance to available assistance. It will replace the Institute of Mental Health's hotline, which has been in service for the past 18 years. Aslam Shah finds out more.
On the line is someone who's anxious but has no one to turn to. Suryani Lim picked the call and guided her with breathing techniques.
And breathe in, 4 seconds, and breathe out.
Eventually she was stabilized, and that's when she was able to share what was going on, what's happening, and that's when at the end of the call, she was very grateful. I feel very satisfied and very fulfilling to go for this job, because there are a lot of ways that we can actually help them.
For counsellors like her, their motivation comes from being able to provide a listening ear and support someone in distress before it's too late.
There's no such thing as, too early for help, really, right? What's most important is that we all learn resiliency skills, even before the mental health distress comes in, so that we can, have as good a quality of life as possible.
All calls across Singapore come here to this room where about 30 counsellors work in shifts round the clock to offer help. More counsellors will be brought in when needed. Now, this is a major step to make mental health support in Singapore simple, seamless and always within reach.
So the most in-demand service right now are users who call up wanting to talk to somebody about their distress. So our counsellors would respond to them and be very empathic to respond to their distress. The next most popular service is finding help. And at 1771, we have developed AI tools to quickly match the person's needs, where they stay, to a service that's nearest to their home.
If the counsellor does not have the expertise to deal with a case, there are community partners that Mindline can refer calls to, such as addiction specialists or behavioural therapists.
Over the last few years, we have actually already put forth quite a lot of resources in the community. Today, we have more than 200 community touchpoints that those who need mental help may be able to access. But because there are many, many touchpoints in the community, it is important to provide some wayfinding for those who need help as well.
The Mindline will continue to grow its pool of partners. It also provides text services manned by actual counsellors. This allows callers to remain completely anonymous.
Existing specialised helplines like those for suicide, teen pregnancy or problem gambling cases say the new Mindline 1771 will help them better allocate resources. And that's amid growing demands on call centre volunteers. Claudia Lim with more.
The Samaritans of Singapore has been taking crisis calls for over 55 years. In 2024, more than 47,000 people called for help. With a new national mental health helpline, the partner organisation says it can better plug the gaps and making sure everyone receives the right help.
We do have triaging process between us and Mindline. Typically they receive calls that are not so crisis, right? And if let's say they have a crisis call, they are suicidal, they will then refer to 1767, which is SOS.
Mr. Tan says the new helpline will also give SOS more time to focus on crucial cases. That's especially as yearly cases grew about 15% over the past 5 years, and calls become increasingly complex for its volunteers. Other specialised helplines, like those that cater to teens, problem gambling or sexual assault cases, say they're still relevant despite the national number.
Specifically for us, we support teen pregnancy. So we are aware of how best can we communicate, how best to keep a safe space for the individuals who reach out, not only for teens, parents, or even school counsellors, or even partners. So specifically for the health or mental health area, they will be aware of the resources and how best to assess what to say, what not to say.
Ms. Wong says that all helplines together form a community to complement and support each other, all to give individuals the best help they need.